So as we begin, I wanted to go right into this concept, which is sentinel and fundamental to what we are doing in this program. And to understand that, I've entitled this just next 5 minutes, Race Matters in Myeloma Care and Survival. And what I mean by that and what we're trying to demonstrate today is that when we look at the tremendous improvements we've seen in survival in multiple myeloma. And maybe you're here today and you barely know what myeloma is. You might even think it's a skin cancer. It's not. That's melanoma. Multiple myeloma, as we're going to explain to you today, is a blood cancer. But whether you have little experience or extensive experience in myeloma, you may know that we've seen a tremendous improvement in survival in myeloma. This was a cancer when I started in it 25 years ago, where most patients didn't live 1 to 2 years. We've seen a huge improvement. But sadly, we've not seen that same improvement in certain groups of individuals. And I'm going to share with you a little bit of why that is and what we're trying to do to overcome that. So to start with, myeloma is considerably more common among African Americans. And the incidence, as you can see here, is growing. We're expected in about the next 10 to 12 years that roughly 24% of all newly diagnosed myeloma patients will be of African descent. And so that is a really striking number. Even right now, roughly 1 in 5 patients in this country are African American. So this is something that is, when we think of myeloma as being a generally, as I'll show you, a rare cancer, maybe 2% of all cancers, it's considerably more common in the African American population. And indeed, this is because it is twice as common in the African American population when we compare it to white Americans. So the incidence or the rate of the disease is twice as high in this population. And that's one of the reasons why we're seeing such an increase in incidence. Not only that, this is a disease that, generally speaking, the average age of diagnosis is around 69 to 70 years. It's about 71 years in white patients, about 69 in Asian patients, 66 in African Americans. So the average age of diagnosis is about 3, 4, or even 5 years younger than the average. And although today we're focusing within the African American community, we know that other groups are also at high risk of myeloma, including the Hispanic community, where the average age of diagnosis is even younger at 65. And this becomes important because often as doctors, we're trained to think of myeloma at certain ages, and we may not think of it in the younger population. And so this becomes one of the reasons why the diagnosis is not made as quickly as it could be. As I commented earlier, although African Americans comprise about 14% of the total population of the US, they comprise 20% of all myeloma patients. And that's reflective, as we said before, of the increased incidence in this population. Now, perhaps the most depressing yet pressing statistic that I can share with you today is that, as I commented earlier, we've made huge progress in survival of myeloma, but we've not seen that same progress in African Americans. So the way these numbers may be confusing, but the way to think about it is for every roughly 1.5 years that we've gained in survival in white Americans, it's only been about 3/4 of a year in African Americans. So the survival advantage or the improvement has been half. And honestly, this has not just been from one study, as I show you here. Sadly, this has been from multiple studies showing that really the average survival of Black Americans is half that of white Americans with multiple myeloma. And that's what has driven us to do this program. Part of the reason for that, we believe, is the time that it takes from someone developing symptoms to actually getting the diagnosis. So I'm going to be sharing with you later the basics of multiple myeloma, but to help us understand that, we'll learn that there's no one perfect symptom or sign that tells you someone has myeloma. It's a whole series of different things. And so we've learned that the average patient actually goes to their primary care doctor 3 times before their myeloma is diagnosed. And this delay is even longer in African Americans for reasons like confounding diagnoses. A lot of things in diabetes and myeloma can be similar. having access to the right testing and care, having awareness within the primary care providers, and being able to be referred in a timely manner to specialists to take care of them. So you're going to hear a little bit later how the IMF's Empower project, as we try to change the course of myeloma, we address each of these in turn in trying to improve the time to diagnosis for multiple myeloma patients in general, but specifically within the African American community. One of the other reasons why we see inferior survival or shortened survival, or frankly, African Americans living shorter lives with multiple myeloma than white Americans, has to do with access and to what we often call the 4 T's. I start with these 3 T's on this first slide, 3 T's of triplets, as we're going to be hearing from myself and Dr. Voorhees shortly. Triplets just means 3 drugs that we use together as a combination to treat myeloma. Transplants, or what we used to call bone marrow transplants or stem cell transplants, which we know are important in myeloma. And then this whole brand new therapy that we have in myeloma, something called CAR T cell therapy. And we have shown, sadly, that although these 3 things are really important in the myeloma journey and the care of myeloma patients, African Americans are less likely to have access to all 3 of those. And indeed, there is, as I'll show you here, there is a 4th T, and that T is clinical trials. And we know that clinical trials and research, and we'll be chatting a bit about that today, has had a real positive impact on improving survival in myeloma. This is where we've developed new drugs and new ways of tackling myeloma. And sadly, as I shared with you, even though African Americans comprise 20% of myeloma patients, they only present about 8% on clinical trials. The last 2 facts to share with you for those who are really more adept in myeloma and are more experienced in understanding how myeloma is really not one disease, it's multiple diseases in one. We've learned that myeloma is really complicated. And one of the things that helps us understand myeloma is that the genetics of those cancer cells, meaning how aggressive is this myeloma. Sometimes myeloma can be slow growing, sometimes it can be very fast growing. And interestingly, we have things that can give us a sense of, do you have slower growing or faster growing myeloma? And believe it or not, African Americans are more likely to have slower growing myeloma and less likely to have faster growing or more aggressive myeloma. So they have more likely to have this thing called translocation 1114 or T1114, which just means that there's an issue with chromosome 11 and 14 hooking up together, and less likely to have this thing called 17p deletion, or part of the 17th chromosome missing. And you would think by that outcomes would be much better. You think that African American patients would do much better with myeloma. But alas, as we've seen before, by virtue of what's happening in our country, that is not the case. But let me end on a positive note, that in certain systems, like in the VA system, when we have equal access to care, we can see that African American patients actually do better and live longer with myeloma. And that's what is also driving our Empower program, is that we know we can do better. It's not that Black patients have a more aggressive form of myeloma, so we expect them to have an inferior outcome. We know that they can do better and should do better. So what are we doing about this? And I'm going to come back to this a little bit later, but I just want you to understand that we have a whole program dedicated to this, where we're seeking to bring awareness, education, advocacy, and empowerment to the community in general. We're bringing education, cultural competence, and access in the medical community. And then we're also working with the regulatory and corporate communities to bring the right policy, expectations, and commitment. And we feel that when all of those stakeholders are working together, this is going to be a chance to improve things and truly change the course of myeloma. And we believe that the International Myeloma Foundation is poised to do this, and to do this very well. So this is why we've created our Empower project. And what does Empower stand for? Well, it really stands for myeloma power. The M stands for myeloma, and it's obviously a play on words, where we're trying to empower patients to change that current course of myeloma, both patients and their whole communities, as we're going to be hearing shortly, to increase awareness, reduce the stigma, shorten that time to diagnosis, and educate our providers about better care for them. So that's our quick introduction. And now I'm going to have a quick conversation with the boss. I know sometimes he doesn't like it when I call him the boss, but frankly, he's the boss. And so our relatively new, I don't know, Yelak, if I'm still allowed to call you the new president and CEO. I think you've passed about an 8-month mark, but I guess we'll give you till 1 year before we say that you're no longer the newbie. But Yelak Biru is our president and CEO of the International Myeloma Foundation, and I want to welcome him and thank you so much for joining us today, Yelak.
Thank you for having me, Dr. Joe. This is such an important program for the IMF and the broader myeloma community, and I'm glad to be here.
Well, it's wonderful to have you, my friend, and it's a privilege. It's a privilege for me as a chief medical officer to report to a CEO who himself is a myeloma patient. That means a great deal to me that my president is a myeloma patient. So, yeah, like maybe tell us a little bit about your story and how it is that you ended up with us at the IMF.
Yeah, so my official title, as you said, is President and CEO of this fine organization. And I joined IMF November 12 or 15. I think there is still some controversy about that. So that's, I think, a little over 7 or 8 months. By training, I am a computer scientist. By profession, I'm a data analyst and a data scientist, and I helped organizations develop data-driven strategies. I have worked with consumer packaged goods and retail organizations for over 25 years before I got the honor of serving the myeloma community full-time. Although I have been with IMF for a little over 7 months, I have been around the IMF for over 25 years. As a leader of a support group in the North Texas and Northwest Arkansas area, as a board member with the International Myeloma Foundation. But I think, I don't want to say more importantly, but almost as importantly, as a myeloma patient, right? The IMF has walked every step with me as I transitioned from being a patient that started treatment pre-novel therapies to a patient that now is wanting to navigate 15 plus approved myeloma drugs. I think that's what you and the other myeloma experts here will be talking about. I have been
tell us a bit about tell us a little bit about that diagnosis, because you've been a myeloma patient for over 25 years, and I'm not just trying to butter up the boss here, but you clearly don't look like you were diagnosed at 65 because there's no way that you're 90 years old. So tell us a bit about your diagnosis, because that must have been something very unique, obviously, especially considering your young age.
Yeah, I credit my wife and my doctor for my diagnosis. I had a cough that wouldn't go away for about 3 months. And one day my wife said, don't come home until you get your cough tested. And I went to like an emergency clinic or urgent care, and they did a lot of tests, and they said, no, you don't have pneumonia or upper respiratory infection, but you are severely anemic, and you need to figure out why you are severely anemic. So this was in December of 1995. And 3 days after that interaction, I went to an internist that I found on the yellow books at that time. It was almost pre-internet. There was no Google and any of the things that you can do in order to be able to go out and search about myeloma or anything else. The diagnosis was kind of unique. One, I was only 25 years old, and it was 3 months before my 26th birthday. We were newly married. I was going to graduate school and looking forward really for an exciting life in the Dallas-Fort Worth area, having relocated from Ethiopia a few years before that. I was told I have myeloma over the phone at a place where I was doing internship, and I was actually in a shared group room as an intern with no privacy. When the doctor called me, the receptionist called the internship room, and she said, your doctor wants to talk to you. And the doctor said, hey, is this Mr. Biru? I said, yes. I have the result of your test. She said, you have multiple myeloma. It is not curable, but it is highly treatable. Please come to my office tomorrow and we can discuss your options. So I didn't know what multiple myeloma was, but I was grateful that he did not say cancer, now looking back, because it set me up in the right road. He also said it is not curable, but it is highly treatable. So my mind immediately said, let's treat this thing and get it over with and move on with life. But soon thereafter, I was told it is actually cancer. It affects Blacks more than it affects Caucasians, or at a rate of 2 to 1. And it affects elderly men. And when I was told, I actually was happy that it was me who had myeloma and it was not my dad or somebody else elderly in my family, because one, I was here in the US and I felt like I could get all the treatments I needed. But two, I was young enough to withstand anything they threw my way. And they threw a lot at me at that time, minus a transplant, which I opted out of.
Wow. I mean, tremendous story. I mean, imagine 25 years old, newly married, newly moved to the US, life ahead of you. It's a terrifying diagnosis, I'm sure. And I know that there may be people listening today who themselves or a family member have recently been diagnosed. Yeah, like that was 25 years ago. And we know that sadly, most patients don't have that same survival, and don't have that same outcome that you've had, although we are so thrilled and encouraged that you've had. In the last few minutes we have, tell us a little bit about the hope that you've had throughout this, and what has driven you to remain positive. And I mean, you are sort of a quintessential survivor to us, and maybe you can share a little bit about that with us, because I think it will give encouragement and hope to those who are battling this terrible disease.
Yeah, I know I'm lucky, and when I lined up to get myeloma, I got, I think, a good kind of myeloma, if you want to take it that way. In the North Texas myeloma support group, which I joined right after I got my diagnosis, there were 100 myeloma families that joined that support group between 1995 and 2000. Today, 3 of us are alive. So while I am grateful and happy I am around, I am very cognizant of how deadly myeloma is and how the tide could change fairly quickly. But there are a few things I think that have made my journey with myeloma better. And I think the number one for me is the relationships that I have been able to build are the greatest assets in my journey. Surrounding myself with other people that are going through this journey, joining a support group, being able to be an advocate. And in the North Texas myeloma support group, we actually used to say, and we still do, the journey is made easier by the company you keep. And that is really, in my opinion, one of the major assets I have been able to develop, relationships with people that look like me. The second one, I think, is being able to build a myeloma team that included my local hematologist, a myeloma specialist, an internist, and many others that were important in making sure that my myeloma journey was kind of cushioned from many different areas. As importantly, and this is where my family comes into practice, is looking at the myeloma holistically, both from a physical, a mental, and spiritual perspective. Having my family support me in the spiritual aspect. I don't necessarily consider myself spiritual, but my extended family is. And so it actually allows them to be part of my care as I move forward with myeloma. So that relationships and looking at myeloma more holistically, I believe has been an important aspect for me to be able to live with myeloma as long as possible, as long as I have today. But I also look at this, Dr. Joe, from the perspective of I stand on the shoulder of many who have come before me. I want to pay it forward.
I shudder to say anything else. You've said it so beautifully. Thank you, Yelak. Those inspirational words and also just practical advice about your relationships, surrounding yourself with others who can help you, building a strong myeloma team, looking at your myeloma and indeed your life holistically are lessons that all of us should learn. And I really appreciate you taking time to be with us today. And we're privileged to have you lead us. And we're very, very thankful that you have decided to leave, as it were, the corporate world and join us at the IMF. And we're very thankful to have you. So thank you again very much.
I couldn't be happier.